2 at once? Wow.
Were you expecting this?
Shut up. You're having twins?
Twins? Well, I guess that means double trouble.
So you're going to need 2 of everything?
All right, friends, I promised in season 2 that I would bring more guest speakers because I know everyone is sick of just hearing about my experiences. So today we have Corin with us. Her last name is Blazing. That's a freaking dope last name.
Thank you.
Did you ever go by like Blaze when you were little, or is that just too cheesy?
Not me, but my dad did.
He did? Yeah. I love that. So we have Corin with us here today, friends, and we are going to be talking about sexy pelvic floor stuff. Is that what we call it?
Yeah,
pelvic
we can
floor
call
matters,
it
stuff. I mentioned this in season 1. When I left the hospital, I think the first call that I made outside of my friends and family was pelvic floor PT. Mm-hmm. I was literally like, okay, great. I gave birth yesterday. Let's get on the schedule. So I am the biggest proponent of pelvic floor. I think that it is so important. Clearly, that's why you're here today. And I'm such an advocate for other moms. Whether you are pregnant, whether you just delivered, whether you had a baby 3 years ago, it doesn't matter. You need pelvic floor help.
Yep, definitely.
So, Corin, tell us a little bit about yourself, how you got into this.
So I have been treating for 7 years. I went to my undergrad in Winona State University, and then I did my PTA degree in Iowa. So I'm a physical therapist assistant, so I work under a PT. But if you kind of think of it as like a physician's assistant working under a doctor, it's very similar. So I pretty much do everything a PT does. I just don't do the initial evaluations. So just a little bit about that. I got into pelvic floor PT about 3 years ago. I kind of started seeing a lot of pregnancy and postpartum in my orthopedic clinic, and just felt like there was a gap in their care. I feel like a lot of people just don't know about pelvic floor. And so I wanted to educate myself a little bit more, be able to provide better treatment for them. So that's kind of how I got into pelvic floor. And now I've been doing that for the last 3 years.
And God bless Corin. I see her every week, and I look forward to it. She has helped me so much. I want to talk a little bit about what does pelvic floor PT even mean? Because I can tell you when I was pregnant, my first time with Jude, all I was thinking about was basically how's my vagina going to heal? Like I never thought about anything aside from that. Like, okay, I need to heal this tear. And I didn't know anything about pelvic floor. Like really someone was just like, you got to get into this. You got to try it. And I was like, okay, whatever. Like I'll give it a shot. And now I am clearly the biggest believer in it. But what really does pelvic floor, like what are the changes that happen when you're pregnant? Why is it so important to get care during pregnancy, but then also postpartum?
Yeah. So when you're pregnant, the pelvic floor changes a lot. You have hormone changes, the weight of the baby as it grows. It's working overtime to support all of that. And so it's never too late to start pelvic floor PT. So even if you're like 2 weeks from giving birth, if you're like just hearing this and you're like, oh, maybe I should go in, like that's totally fine. Because we do a lot of prenatal care, but also helping for like labor and delivery. The pelvic floor, maybe I'll kind of start with that too, because that might help people kind of understand what the pelvic floor is if they don't know.
Yeah, and hopefully they know where it is. I don't think I did tell my first pregnancy. I was like, the pelvic what?
Yeah.
Clearly I failed any anatomy or any of that in school.
No, that's okay. I feel like a lot of people don't know. So the pelvic floor is a group of muscles that kind of make up like a hammock under the pelvis. So it supports the uterus, the bladder, the bowels. And so when you think of the added weight from the baby during pregnancy on all those structures, like, the muscles of the pelvic floor are going to need to work a little bit more. Some people, maybe you don't have any like symptoms and you just want to like learn more about it and we can help with that, but maybe you do have symptoms. So a lot of the symptoms that I see, common ones, there's always like the outliers, but the common ones that I see: low back pain, tailbone pain, pubic bone pain. And I don't know if you experienced, I know you have some low back pain, but any other things going on. But like the pressure, some people will feel like a lot of pressure and pain through the pelvic floor. Any leaking, like coughing, sneezing, even just like walking up the stairs or walking down the block. Some people will have leaking with that too. So it could be constipation symptoms. The list goes on, but those are pretty common
really
ones.
Sexy things to talk
yes.
about. Like the really fun things when your friends are like, how are you? You're like, good. My butthole hurts.
Yeah.
I have pain in my back. I'm peeing all the time. Oh, and don't make me laugh or I'll pee my underwear.
Yeah, exactly. Yes. All of those things we can help treat. They're all super common. I think my mom's generation and my grandma's generation, like they don't talk about that stuff very often. But I think times are changing. Like we're trying to talk about it more and educate people more on it. And so I think knowing that like those things are common, but you don't have to live with them is helpful.
Yeah. I love the fact that you just said too, like it's never too late to start, because I am like an open book with my girlfriends. I will straight up just send a text and be like, the kids cluster fed, my nipples are on fire, I'm not going to make it through the day. Like I'm too much of an open book, but so many of my friends have incontinence and they're like embarrassed about it. They're like, oh, I can't do jumping jacks or I can't get on the treadmill with my kid. And they think that's it. They've already ruined it. You know, they delivered 2 years ago. There's nothing they can do about it now. Yeah. But you're saying that's not true.
No, it's never too late. I've seen patients who gave birth 30 years ago and are still dealing with leaking and back pain.
That's a nightmare.
Yeah, right. You know, like the older generation who maybe didn't want to talk about it and, you know, tell them about their intimate issues. Like I've seen patients like that and they do make improvements. It might take a little bit longer, but it's never too late. Never too late to start at all.
That pressure you're talking about for moms out there, for me, this happened after I delivered with both Jude and the twins. It was like maybe 3 weeks after delivery. The best way that I can describe it is like I had a dumbbell in my vagina. It was like
that's a good,
this heavy weight that
that's a good way to explain
it's not
it.
like I was doing a Kegel and trying to keep anything in, but I remember calling my doctor, my OB, and I was like, we need to come in. Like something is stuck up there. Yeah. Like, something is not right. And that's when she was like, you know, again, keep going to pelvic floor PT, because it's like this weird weight that feels like your vagina's holding, but it's your pelvic floor.
Yeah. And sometimes people will also, I think one of the symptoms that I missed too is prolapse. Some people might have like prolapse symptoms. So yeah, any of those things. If you feel any of those symptoms and you're like, this is not how my body normally feels, it's always good to like go check in with your doctor, your OB, talk to them about it. And then maybe pelvic floor is like a good place to start.
Yeah. Talk to us a little bit about what maybe someone can expect during an initial visit for pelvic floor therapy, both when pregnant and then after delivery.
Yeah. So we'll start with pregnancy. So pregnancy, a PT session might look like, it kind of depends on symptoms. Like if you're coming for preventative measures, we might do a general assessment with like muscle strength and mobility and, you know, trying to keep you as strong and as mobile and active as possible throughout your pregnancy. If you're coming because you do have pain, could be any pain, shoulder pain or back pain or any of the pelvic symptoms that we talked about earlier. Sometimes an internal assessment is appropriate, sometimes not. We don't have to do one.
Yeah, I feel like people need to be prepared for that because no one warned me. So here I am like, I don't know, 28 weeks pregnant with Jude, and I'm just walking in and I'm thinking like I'm going to be sitting on a bouncy ball with like a band around my legs. And immediately I was not seeing Corin, I was seeing someone else. They were like, okay, like drop your pants. And I was like, wait, why? Because, you know, when you're pregnant, you are so sick of people going in there. You're like all the time your pants are off at doctor's offices, you know? So I think that is something I'd like to tell our moms out there. Like, again, like Corin said, it's not mandatory, but be prepared for that.
Yes.
Because I was like, wait a minute, what are we doing?
Yeah. It's a good way for us to assess the pelvic floor muscles. So, you know, if you are having symptoms and the muscles are tight, or maybe they're weak, we're going to give you a specific program to help with that. So yeah, it's a little intimidating, especially if you're not like ready for it.
Yeah. I wasn't.
I think we all do our best to like try to prepare patients for it, but that doesn't always go to plan. And even doctors sometimes don't always know exactly like what we do. So sometimes they also don't really prepare patients as well when they like refer them to us. But we try to make it as painless as possible and like easy and comfortable. It's like, it's a little intimidating and scary. And so, we always ask for consent and like, make sure that the patient always feels comfortable.
Yes, you're very professional.
Yeah. So we never, yeah.
Yes.
Yeah. We're like, if a patient is super uncomfortable, we're never going to like force you to do that. Just so you guys know out there.
Yeah. I will say though, like I do internal release. Is that what you call it?
Yeah. Internal release.
Which has really helped my back because Corin knows I am crying and complaining about my back all the time, and it does help. So if you're hesitant on it, get over it. My gosh, you're either about to deliver a baby out of there or you've had people all up in there during delivery. So really what's one more person? Okay. And then talk to us a little bit about maybe what the experience, like what is the timeline after you deliver that you should be getting in, how frequent, and I know it varies patient to patient, but just generally what that visit might look like and like the cadence.
Yeah. So I would say it definitely varies depending on if you have a C-section versus a vaginal delivery. It might look a little bit different. You can come into pelvic floor PT as early as 2 weeks. The treatment's going to look a little bit different. We're not going to be doing an internal assessment that early. We definitely want to wait until the OB clears you, usually at your 6 to 8 week checkup. I find that a lot of my postpartum moms will come at like that 6-week checkup because they don't know they can come earlier.
Yeah.
And they're having like back pain or shoulder pain from feeding their babies. And so that earlier time period, that like 2 weeks postpartum, I like to do a lot of functional things. It's like feeding positions or how to get up from the floor carrying your baby safely or how to get out of bed. Like sometimes like the core is weak, it's been stretched for 9 months. So how can you get out of bed without having that extra load on the abdomen? So we do a lot of functional things during that first like 2 to 6 week period. Maybe it's mobility, some stretching. Breathing is super important. So we always touch on breathing. But yeah, after that 6 week, then if everyone's okay with it, we'll do the internal assessment.
Yeah, then the real stuff starts.
Then the real stuff starts.
I didn't come until, I think I was like 6 weeks in. I regret that because my experience personally was I was doing fine. I really didn't have pain. My back was fine. My vag was fine. All of it was fine. I was just like, wow, this is crazy. I feel so good. Like,
great.
Yeah. I felt like I got like blessed by the delivery gods. And then right around 6 weeks, it hit me like a brick wall. My back was killing me. My shoulders, I had that like weird weight dumbbell in my vagina. Yeah. So I would encourage any mamas out there, like, you don't have to do internal before 6 weeks, like Corin is saying. But if you can get ahead of it, get ahead of it. Because you have the breastfeeding positions. It's crazy. You're always in the most awkward position because your baby's screaming and you're just like getting them latched as fast as you can, and then you pay for it.
Yep, exactly.
Yeah, you really pay for it.
Yeah. Yeah, and it's hard when you're like trying to figure, especially new moms, like maybe a second time around you have things figured out a little bit more, but especially the new moms, everything's new. You're trying to figure it out like position wise, and your brain is all on the baby, I feel like, and not a lot on the mom and yourself and like the recovery. So I feel like it's important to get in and get your recovery started.
I feel like I was so mindful with Jude on the positions when I was breastfeeding, like, okay, feet flat on the floor, sitting up straight, don't hunch. I was much more mindful. And now with the twins, I'm like, there's a picture of me, I'm literally feeding on a tractor. Yeah. I'm like, just shoving a boob out. I'm like, the kid's screaming, we're trying to feed a horse. Like, it's almost, for me, it's been worse with the twins. Was it? Because, when I'm chasing one around.
More distractions.
And when two are screaming, you're just like, oh my God, how can I shut these babies off? But, no, I think you bring up such a good point because let's face it, moms do not take care of ourselves. We don't.
No.
We try to a little bit during pregnancy, and then it's out the window. Like it's literally gone. And I have made it such a priority in this postpartum, 4th trimester. I'm like, nope, I will go to the chiropractor, I will go to pelvic floor PT, and I will go to acupuncture, and that's how it's happening. And bless my husband, I'm just like, bye, I'm leaving. Like I have these appointments because really, moms, like you cannot be the best version of yourself for your baby if you're in pain. You just can't.
Yeah.
And like I think more women, I mean really men too, need to advocate for like there has to be a healing process. I mean 6 weeks, like that's crazy. That's what the average person gets off work too.
Yeah, it is crazy. And it's kind of funny because in Europe, it's like mandatory. Like you give birth, you go to pelvic floor PT. Like that's just whether you have symptoms or not. Here it's not really. Like some women will go to their 6-week checkup and be fine, and they'll be like, okay, you're good for all activities. And that's gonna look so different for every person. Somebody might like bounce back great and they can like go run a mile, which is great. And then some people might be in immense pain. Some people might have pain with intercourse and like things like that. So it's going to look so different for everybody, but I think it's just helpful to know that like we're here to help.
Yeah, and you guys make like you normalize the things that we're feeling and going through, but you also alert us of the red flag of like, okay, this is normal, but this is not normal.
Yes, like
like we got to help this.
Yes, yes, definitely.
Yeah, let's talk about it. Let's talk about sex. Let's talk about intercourse because I talk about this with a lot of my friends. So I would say I think it's crazy that at 6 weeks they're like, you're cleared to go get it on.
Yeah.
Like I would like to meet the mother out there who that is what she has a countdown for. Because I think I speak for 99% of women when they're like, no, I'm good. I haven't thought about sex in like 10 months and I don't plan to. But for those that are returning to intercourse, what are some red flags to look for that I don't know. What are some red flags to look for? Let's start there.
Yeah, for sure. I always look for, first of all, pain. So, during the delivery process, some people might have tearing, might have prolapse or other things that happen, hemorrhoids, things that might affect the healing.
If you don't have a hemorrhoid, please DM me because everybody I know has a hemorrhoid. That's wild. If you do not have a hemorrhoid, especially, I'm sorry, if you were delivering multiples and you went through pregnancy, delivery, and postpartum, no hemorrhoid, bless you. So let's just face it. Everyone is torn and everyone has hemorrhoids. Continue.
Yes. So if you are somebody who did tear during delivery, sometimes the scar tissue is really tight. It's sensitive. It's not going to feel great with insertion. So that's something to be aware of. How does insertion feel? Is it painful? How does deep penetration feel? Sometimes that doesn't feel too great either. It can be caused by dryness, pelvic floor tension. Your hormones are still recovering. So you're only, if you're trying to have intercourse at that 6-week mark, which
bless you. Wow.
I definitely have had patients and they're totally fine. But like you said, the majority of women might be a little, they might want to wait a little bit and that's totally fine. But those would be things that I would look for is like pain with insertion, pain with deep penetration. There's a lot of things that we do to help with that. So
yeah, I feel like for me, it's like, for so long, you were just trying to keep these things inside of you, right?
Yeah.
Like with twins, it's like, you got to make it to 30 weeks. You got to make it to 32.
Yep.
And then you finally get them out, and the last thing you're thinking about is getting something else back in.
Right.
You're like, just give me a moment. But clearly, my husband and I did go back to having intercourse in between Jude and having the twins. So for anyone that's discouraged or is like, okay, it's been 5 months and this still hurts really bad, that was us. We got over that. But like your best friend is lube. Like people don't want to talk about it. Like they don't want to talk about the lube. It's like, no, you need to make a damn slip and slide.
Yeah.
Or it's not going to be fun. Like, let's just call it what it is, you know?
Yeah.
Because I think that people are weird about talking about this, but we all clearly, if you're pregnant, you're doing it.
Exactly. You're doing it. And if lubricant is not working for you, there's so many different kinds of lubricant out there. And also there's other means like treatments and things like that. So like talk to your OB, talk to your pelvic floor therapist. We always have other little tips and tricks that you can use too, but lubricant is a great place to start. Yeah.
Amazon that. You mentioned this earlier, and I definitely want to talk about this because I think that if you're a singleton listening to this podcast, this all applies to you as well. If you are a mom of multiples or expecting multiples, I know the entire time I was pregnant, everyone kept preparing me for a C-section. It was like all everybody talked about. Let's talk about why people that had a C-section still need pelvic floor PT, because I think there is a myth that they don't need it.
Yes. That's a great question. So people who have had a C-section, I would say definitely can benefit from pelvic floor PT. For a number of reasons. Your pelvic floor is still affected during pregnancy. So even though you're not having a vaginal delivery, you're kind of like the changes we talked about earlier in the podcast, the hormone changes and the weight that the extra weight from the baby that the pelvic floor has to take up. All of that can make long-term changes in it. So you might still have pain with intercourse. You might have hip pain or that nagging low back pain. Doing a pelvic floor release, if your muscles are tight, can definitely help. C-section in general, though, like scar mobility, getting the core to engage again. They have to cut through to get to the uterus.
7 layers, right?
Yeah, it's a lot of layers. And so reconnecting to the deep core, helping with some of that scar tissue mobility, definitely helpful. And that's all, we do that all in PT. So
yeah, I think I never really thought about that, the fact that they are cutting your stomach open, because my personal experience, as you know, as my therapist, has been that I just can't get my core fired back on. It's very confusing to me because I can see my core muscles like visually in the mirror. I'm like, they're back. And then I do literally a plank for 4 seconds and I'm like, they're not back. Yeah. So I think for anyone that had a C-section, that is really important to remember. Is like, my guess is their core went through maybe more than mine did with a vaginal birth.
Yes and no. Yeah. I mean, everyone's experience is different. Like I said, like depending on how you carried the baby, like your experience, right? Like you had twins too. Those muscles just had a hard time contracting during your pregnancy. So yes, you didn't have 7 layers cut through your belly, but you still have all of that like muscle contraction that we still need to work on just from like the muscles being so stretched out. They're challenging in their own ways. Like maybe in some ways it's easier, but I think they both are challenging. It doesn't matter how you give birth.
No, even if you adopted, go to pelvic floor PT. It doesn't matter how you became a parent. It's so hard.
It's hard, and they're challenging in their own ways. They all have their own little like things that, maybe vaginal delivery, you have more pelvic floor issues, but cesarean, maybe you can't get your core to fire, maybe you have more back pain, or I have a lot of women who will have a lot of sensitivity through their abdomen because of the scar tissue. So it doesn't really matter. I always say it doesn't matter how you give birth.
Get in.
Yeah, it's everyone can benefit from it.
Okay, I never know the like proper medical term how to say this. I always just say I split my abs. That's what I tell the people all the time. I'm like, my back hurts because I split my abs. How do you actually say the term?
So diastasis recti.
Okay, yes.
At least that's how I say it. I know some people say it a little differently, but yeah.
Well, yours is more professional than mine, okay?
Splitting the abs.
Let's talk a little bit about that, because as I've opened up to more moms about this experience, all of them are like, I have that too. I have that too. What does it mean? We will recover. I've been told.
Yeah.
Takes a year maybe, but
you will recover. So the diastasis, very common, something that we can definitely work on. It is a separation of the soft tissue in between the two sides of the muscles of the abs. So by the time everybody gives birth. Everyone has some sort of a diastasis. If you are one of the lucky ones and postpartum don't have one.
Who also didn't have a hemorrhoid and didn't tear. Like, what are you, Giselle? Like a Kardashian? Like, who are these people?
You did have one, like, probably when you gave birth, at least, because that's how your body makes space for the baby to grow. That's just where it can separate, and, a baby has more space to grow. So for treatment of that, the transverse abdominis is that deep muscle. I know you're very familiar with that. We talk about it all the time.
All the time.
But our goal for healing that is learning how to properly load the core, so that we're not forcing that separation to get worse. So some people might present as like a coning, where it like kind of lifts up when you're engaging the abdominals. Some people might not present with that, but if you put your finger in the center of your core.
I will never forget doing what she's about to talk about. I almost threw up.
Your fingers can kind of sink in. So that's also a way a diastasis can present itself.
I mean, I'm not saying to go home and diagnose yourself, but basically you lay on your back, you do this little mini crunch, lift your head, and put your fingers like in the center. I mean, the center of your like belly button. Yeah, whatever. And you're going to feel this little ridge. And I was like, I had to take a couple deep breaths. I almost barfed. Clearly, I don't belong in the medical industry.
But yeah, your OB, your pelvic floor PT, any of us can help you figure out if you have one, and if you do, how to treat it. But a lot of it is learning how to properly activate your core. But there's a lot of research that shows, if you can properly manage your pressure inside of your trunk, it doesn't really matter if you have one or not. A lot of people's diastases don't necessarily go away, but they learn how to manage it. So
yeah, I think maybe I'm going to call this podcast Loading Your Core, because that is like, honestly, for me, that is the most challenging thing since giving birth. It's the thing I know I need to work on the most. Mm-hmm. And Corin has sent me some exercises, which I am going to post when we put this podcast live as well. They are like the tiniest ab exercises. Like, I'm pretty sure my 2-year-old could do them. And holy smokes, I'm sore for like an hour after I do them. Like, it really does not take much. I think people think like, oh, I got to do 60 sit-ups and then like get into a 3-minute plank. No. Yeah. Don't do that, in fact.
No, don't do that. Go see a pelvic floor PT. They'll tell you what to do. It's the smallest movements, really. Like you said, that's all you really need.
Yeah, because those transverse abs, man, those are like, they're so hard to get to.
Yeah.
They're like the hidden gold in there.
Yeah.
It's like you got to dig.
Yeah.
While we're talking about abs, let's talk a little bit about returning to exercise. Mm-hmm. I know for me, it's my therapy. Like, going to the gym, sweating it out, going to yoga, it's where like I release anxiety, a lot of things. Mm-hmm. And I feel like the minute I left my 6-week appointment, I was like, great, going to Yoga Sculpt, gonna have 8-pound weights, here we go. Yep. And I'm learning that is not just because my mind says I can do it, it's not great for my body. So talk a little bit about exercise and getting back into that.
Yeah, it's very common. Like the 6-week checkup, they're like, you're cleared. And a lot of people will do that as well. There's a lot of weakness and things that your body hasn't done since being pregnant. So yeah, usually there's going to be a transition period to get back into like return to sport, whatever activities you want to do, running, skiing, whatever it might be. So yeah, I would definitely say like give yourself time, give your body time to heal. When you come to pelvic floor PT, when we do the full assessment, we'll kind of see like where's their weakness, where's their tightness, and we give you a really good overall program. Our goal is to help you slowly progress so like no injuries occur. If you don't have any pelvic floor symptoms, great. We don't want to cause any. So like our programs are made to just make sure that like, you're getting a well-rounded program with the emphasis of, pelvic floor. But yeah, I would say timeline-wise, like that 6 to 8 week after your checkup, usually that's when we can do the internal assessment. If you're weak, we'll give you strengthening. If you're tight, we'll give you stretches to do. That's when we're kind of starting to build up that strength, mobility, whatever we find in the assessment, pretty much. I would give yourself at least 2 to 4 months after that 6-week checkup to really like start to get back into your sport activity. And honestly, I would even give yourself a little bit longer just so that like, I know mentally sometimes postpartum it's really challenging when you can't do those activities. It's hard for moms to be like, give themselves grace.
Yeah, you miss and like you think about your old life. You're like, oh my God, before this I ran 5 miles without thinking.
Exactly. Yeah. And, and you guys are super moms. You're trying to juggle so many things. It's, it's hard to give yourself grace when your body is trying to heal still. But I would say, like, give yourself time. Your body grew a human for like 9 months.
Some of us 2, some of us 3.
True, 3. Yeah,
what
multiples. Yeah, crazy. The body is so cool that it can just do that. And so creating life like that, it's like, give yourself some grace, Give yourself at least 9 to 12 months even just to start to feel like your normal self. Not that you can't go back to your activities earlier, right? But like even feeling like mentally yourself and like physically yourself.
Yeah, and it doesn't look the same. Like I went to a yoga class yesterday, and I think part of like one of my goals for 2026 is like just to be kinder to myself.
Yeah.
And I only got 3-pound weights. Old Abigail was like, I gotta get 10-pound weights and do 600 reps in the front row. I was like, no, that's not where I'm at right now. Maybe one day I'll get back there. Maybe I won't. I don't care.
Yeah.
But I think like to your point, you can get back to physical activity, but just don't expect it to look the same. Don't set that expectation.
Yeah.
Or you might just injure yourself worse.
Yeah. And like, there's the outliers, right? Some people do like can bounce back really fast, and that's great. But I would say the majority of people can't. And so I think, giving yourself that time and being kind to yourself is really helpful, which is hard. It's super hard for a lot of us.
Yeah, it's a mental game.
Yeah.
Well, and I know like I have a ton of oxytocin still being released breastfeeding around the clock. It's all I do. I just breastfeed and then eat, and then breastfeed and eat, and then maybe sleep. And I know you're much more prone to injuries as well because everything's still like loosey-goosey.
Yep, definitely.
So that's something to keep in mind too, moms, is like everything's just loosey-goosey still. It hasn't gone back to where it's at, and you don't want to blow an ACL or blow a rotator cuff or, God, any of those things that I already
Those
did.
all sound horrible.
Okay, so before I had ever even thought about being a mom, I'm not going to lie, I didn't understand Kegels. I still don't understand them. I feel like when you tell me to do them, I'm like, well, I don't know, maybe I just did one, maybe I didn't. But I feel like people associate the words pregnancy, postpartum, pelvic floor PT with Kegel.
Yes.
Why? And what the heck really is a Kegel?
Yeah, so a lot of people do, but not everybody needs them, which is why it's really helpful to get an assessment so that we know that, whatever you need, we're giving you that program. But so we'll start with Kegels. So, I don't know, like I see a lot of stuff online too, like, you need to be doing Kegels, and I think a lot of people overdo them.
I think it's the myth that if you do Kegels too, you'll never be loose. I don't know how else to say that in like a PC way.
Yes.
And that feels weird.
No, that's not, I don't think that's true.
Yeah.
No. But yeah, I think there's so much information online, social media, like Kegels and pelvic health, but they don't talk about the other side of that too, which is really important also. So yeah, if you are having leaking, for example, and it's caused because of pelvic floor weakness, we might add in some Kegels for you. But if you are having leaking because your pelvic floor is really, really tight, Kegels will make it worse. So that's why, I always say better to get a professional opinion, kind of get that assessment, just because you don't want to make things worse. That would not be fun.
No.
With that being said, if you do have a weak pelvic floor, we might do a Kegel. It is a contraction of the pelvic floor. Doing a Kegel, if you think of the vaginal canal and you're trying to, I use a couple different funny analogies, but one common one I hear a lot of is like you're trying to lift a blueberry up inside of your vaginal canal and hold it there. Another funny one that sometimes I use is like a smoothie. Like if you imagine a straw inside of your vaginal canal and you're trying to like slurp up a smoothie. So it's that like squeeze and lift. So that's essentially a Kegel. Again,
but we should not be doing this until we get an assessment, because I like what Corin just said. If you're already have the tightest pelvic floor, which I do, I don't want to make that worse.
No.
So friends, don't just like deliver and then start doing Kegels because you tore.
Exactly.
Sounds like a terrible idea.
Yes, exactly. A lot of times if you have tightness, we want to do stretches. We want to work on breathing, and we call it down training. We use a lot of stretches, common stretches, right, that people might know of like figure 4 stretches and pigeon poses, happy babies. People do that in yoga a lot. We use those stretches to help the pelvic floor relax. So sometimes people need the length first before we do anything else with strengthening. So Kegels, good in some situations, bad in others. Yeah.
Another reason to have an internal exam.
Yep, exactly.
Yeah. Let's talk about 3 healthy habits to support pelvic floor health. Really, like for anybody, I would love this. Not just like for someone that's pregnant or someone that just delivered, but what are like a couple ongoing things we can do?
Yeah, for sure. That's a really good question, and also kind of a hard one because there's so many things that we can do. But I would say one of the big things is diet and nutrition. And you can talk a little bit more in depth with like your pelvic floor PT when you find one about what that might entail. But for example, hydration is going to be really important. And also we have what's called bladder irritants. So like if you feel like you're leaking a lot or have a lot of urgency, we'll talk to you about what the bladder irritants might be to help decrease some of those symptoms. So I'd say diet, nutrition, super important. Diaphragmatic breathing, which I feel like a lot of people... It always comes back to breathing. It always comes back to breathing, and I feel like a lot of people do it wrong.
Yeah.
It's hard. It's harder than what people think. It's not just, breathing in deeply. There's more that goes into it, and breathing, the diaphragm and the pelvic floor, they work as a team. And so doing the diaphragmatic breathing can be really helpful for pelvic floor health. Can you
talk us through what that looks like? I know it's kind of hard without visually seeing
this. Like how to do the diaphragmatic breathing. Yeah, for sure. So if you are listening at home, if you want to put one hand on the side of your rib cage, and then the other hand can be over the belly. So you're kind of having the side and the front for tactile cues. And if you try to take a deep inhale, you want to feel both rising and falling at the same time. Chest and belly are going to rise and fall. Ribs should expand. Both sides of the rib should expand sideways and back and front. So I always imagine it like a balloon. If you blow up a balloon, it expands 360 degrees around. Your ribs should be doing the same thing. That allows for more space for the diaphragm to move and drop down. We want that movement in the diaphragm because that's how we're going to get more movement in the pelvic floor also. So great for overall pelvic floor support and health, because if your pelvic floor isn't moving, that's where sometimes we can get other dysfunctions.
You could honestly just do that like commuting to work too.
Yeah.
Just driving.
Exactly. It's an easy one to do anywhere. It's great. Yeah. Standing, sitting, laying down. It's a good one.
I love that.
Yeah. The list goes on, but let's try to pick another more important one.
You can pick a few.
Yeah, maybe I'll pick a few. Maybe I'll pick a few here. Moving the body, like having a good strengthening routine and a stretching routine. Once you're cleared by like PT for both, again, like there are situations we might not want you to do strengthening right away, but I think just moving your body and staying active is really helpful. And then toileting habits. Toileting habits.
What does that mean?
Yes. So a few different things. So I don't know about you, but when I was younger, I used to, and before I became a pelvic floor PTA, I used to squat to pee out in public.
Oh, yeah. I have sat on 5 public toilets my whole life.
Yes.
I hate public toilets.
Yes. The majority of people do,
Yeah.
I feel like. And that is it's hard for the pelvic floor to fully relax to go to the bathroom when you're squatting because your legs are engaged. So I would say if you're out in public, lay some toilet paper down, use those seat covers. Those little sheets, and sit down so your pelvic floor can fully relax. That's a big one. I feel like a lot of people do. And then straining to have a bowel movement.
Yeah. Oof.
Yeah, straining to have a bowel movement. I know we were talking about hemorrhoids earlier and how
I believe in this. Like, I have a squatty potty now.
Yeah, yep.
Oh, I buy it for all my friends after they have a kid. And, like, anyone even older. I'm like, no, you must elevate your feet so that there isn't, like, I mean, in my mind, it takes a lot of the pressure off.
It does. Yep. It changes the angle of the rectum. So it's, like, super great. Honestly, for anybody, like kids, men, women, it doesn't matter who you are. I think it's just like a good habit to get in. Squatty potty is great. And then straining, even just like holding your breath to poop. I feel like most people do that.
Yeah.
So trying to like breathe out while you're pooping.
I feel like only women do this because I don't know if anyone else has this experience. My husband, he's going to be so mad I'm saying this. He goes in the bathroom. I swear to God, the man reads like the encyclopedia. Yeah. Like, men are in there forever. They bring Brooks. They bring their phone. They, like, do fantasy football. I'm like, is this the most relaxing time of your day? No. Because for women, it's like, get in, get out, I'm done.
No, for sure. No, men spend a lot of time in there.
It's crazy. They must never strain or be stressed. They're just like, you know what? I'm going to be in here 30 minutes.
Yeah. And, you know, that kind of leads to the next point on the toileting thing is if you do feel like you're straining and you can't go to the bathroom, like you're like pushing and you're like, ugh, like nothing's coming out. 10 minutes tops.
Get off.
Get off the toilet. Yes. It's not coming. Get up. I always give my patients, if that's like one of their symptoms, I always give them like a bowel routine to try and then go back to toileting after and see if they like they can have another bowel movement. But yes, that's how you get pelvic floor dysfunction.
Yeah. And I feel like too, you know, constipation is such a normal symptom of pregnancy, but I feel like I'm kind of learning it doesn't have to be.
No.
It doesn't have to be. It's people are like, oh, just sit on the toilet. Like, you're constipated. You'll figure it out. And it's like, no, that's not true. You're making it worse.
Yeah, exactly. Any symptoms you're feeling, they don't have to be there. Yeah. And we're here to help. So
except for just feeling like very tired all the time.
Yeah, those things I don't know if I can help.
That one you're just SOL with these, you know. Okay, Corin, this has been so helpful. Thank you so much for being here.
Yeah, thanks for having me on the show.
I do want to ask you, where do people find a pelvic floor therapist?
Yeah. Honestly, I would say do a Google search, look up reviews. I think reviews are going to be really important. You know, just like anything, there's good ones, bad ones. Find one. Maybe they're all good, but there's one that maybe you clash with personality-wise. So I would say, you know, go online, do a Google search, find a pelvic floor clinic that has good reviews, and then also a therapist that has good reviews, and start there. Sometimes there are some websites from different like courses. Like I took some classes through Herman and Wallace, and I know they have like a provider list on their website, so you can always filter it out by state.
Oh, cool.
Yeah, that's kind of cool. Helpful if you are having a hard time finding a provider. But otherwise, yeah, I just say start there and see, maybe ask friends and family if they've gone and if they have any recommendations too. That's also good.
I know there's like online options. Some of my friends did that. I'm just going to say I would not do that option.
Telehealth or?
Yeah. Like I really want to advocate for moms. Take the 45 minutes and physically go in. Like, the truth is, anytime I do anything online, telehealth, a Zoom or whatever, I'm totally distracted. I'm like watching my kid through a camera. I'm like throwing Cheerios at my other kid. Like, you're not going to be focused and get what you need out of it.
Yeah.
So at least for your initial visits, mamas, physically go into an office And I love what you said earlier about finding the right therapist, because I am always advocating, if you go in and you're not vibing with someone, you have every right to say, I always word it as, I'm so sorry, I just don't think our energies are a good match. And you're allowed to say that, especially if you're going to be having some internal exams. Like, I love Corinne. I want to be friends with Corinne. Hence why she's here. So it was a good match right away.
Yeah.
But I had other doctors throughout my life and physical therapists where I was like, there's no way. If you don't like that person, you're not going to go back.
No.
You're not. You're not
No.
going to make it a priority.
Especially when you're treating something so intimate, like you said. Like, you want to feel comfortable. You want to feel comfortable telling them your symptoms and having internal work done if that's what's needed. So yeah, definitely vibing with your therapist is super important. Yeah.
Okay, friends, for anyone here in Denver or surrounding Denver, Boulder, I just want to go ahead and plug into therapy. That is where Corinne works. That's where I went with both Jude and the twins. I absolutely love them. Please check them out. And the best part is they take insurance, which, Corinne, is that not like really hard to find? Because I was really having a hard time finding anyone that took insurance.
Yeah, it can be hard because pelvic floor is a specialty. So a lot of people are cash based. So it is kind of nice that we take insurance for people who can't really afford it.
Yeah. So friends, call them, and call them pretty much the day you deliver, because when I called, they were like, great, we can see you in about 6 months because you guys are so busy. We figured it out. They wiggled me in. They always will. Their whole team is incredible. But make sure to write down into therapy and you will not be disappointed.
Yeah,
Okay, cool.
thanks for having me on the podcast.
Thanks for coming. I'm so excited. And friends, let this be your sign to go book your pelvic floor appointment today. Go do it.
Yeah.
Thank you.